you on behalf of the International Society for Quality of Life Studies for joining our webinar today. The title of this webinar is called Community Quality of Life, Aging and Migration in Rural Areas. I'd like to first introduce our moderators for this webinar, Anthony Lepentour and Roger Fernandez Serrano, the ISQOLS VPs of online events. They will be facilitating the question and answer period and serving as discussants for the session today. And now to our esteemed presenters. Dr. Hossein Mousazadeh is based in the Community and Wellbeing Learning and Collaborative at Purdue University. Before then, he has worked in Europe, Hungary, and worked on sense of place attitudes on quality of life. He is working on advancing the fields of quality of life, well-being, and community development by conducting impactful interdisciplinary research and delivering innovative education in sustainable development, community empowerment, and tourism. Since then, he has published numerous articles in quality of life, well-being, community development, and tourism. Passionate about fostering inclusive environments, he aims to bridge the gap between theory and practice, addressing the unique needs of the individuals, families, and communities. He is also joined today by Dr. Joe Sirgy, ISQOLS founder and from former emeritus professor from Virginia Tech University, as well as Dr. Zoe Taylor, associate professor from Purdue University, and Dr. Jason Ware from Purdue University. So with that introduction, I'll turn it over to you, Dr. Mousazadeh.
Yeah, thank you so much. Hi, everyone. Thank you so much for joining us today for the ISQOL webinar. Before starting my presentation, I want to thank ISQOL to providing the opportunity to join them at the webinar, and I hope we can go and continue, which is started now, on community quality of life in aging and migration in rural areas. My name is Dr. Hossein Mousazadeh. I'm a postdoctoral researcher in Purdue John Martinson Honors College on community and well-being learning collaborative. I'm going to have a presentation on community quality of life and addressing the need of the changing demographic as a call and action, which we started recently, and we hope we can continue and work on in the rural of Indiana. But today is a kind of call to action, and then I'm going to have Indiana as a case study and talk about that more and more. So, I think here. Okay. So as a introduction, the rural aging trend as a growing concern in the United States expressing the significant demographic shift with older adults, which representing a rapidly growing segment of the population, which has come from many of the reports from it show this trend is particularly coming from moving from urban areas to non-metro areas, which we can call here as a newcomer to rural area of United States. The recent USDA report highlights that the aging baby boomer generation led the significant rise in the rural elderly population during the 2010 and then early 2020, kind of between and after the COVID-19. There's a huge migration from urban to rural areas on United States, which we call them as a migration, or other word is, I believe, is better than the migration, to make sure everyone understand that we can call them as a newcomer. So the number of the older age counties, where at least 20% of them are age 65 or older, are tripled since 2010 in United States rural areas. Here is a map for percent of the population age 65 and by the county. If you can look at this map, you can see the percentage of the population age 65 and more than 65. You can see all the states, they are starting, they have a lot of, I have another map, I will show that in the next slide. You will see that information is true, where the population, the older adults aging, moving from urban to non-metro, which called the rural areas in United States. Here, as in the non-metro older age counties, you can see there is a lot of the white is metro. Like if you just go and see here in the Indiana state, you will see the Indianapolis as a metro area, but other place like they are called as a non-metro, suburban, also rural areas. There is huge of moving from urban to rural areas. Another map is shows as a 2022 annual report as a state ranking about the health and the less healthy county state in United States, which is shown in the map. And New Hampshire is the first rank, and then Massachusetts, and then Vermont ranked 1, 2, 3 as the best state for healthcare state, and then we have the Mississippi, and then Louisiana as the number 49 and 50, which is need also more action and more care, and also work more and more on Mississippi and Louisiana regarding that. Here is another map. It shows a change in home health care. This establishment for non-metro counties, again from 2010 to 2023. If you can look at the map for Indiana state over here, like there is a early lake of the healthcare establishment in the rural area of Indiana, which I have here kind of information for an Indiana state as a case study, which we started to work on it recently, and have submitted some grants there as addressing the need of the changing the demography as a call to action. As an Indiana is certified rank in the nation in overall health. It's come from 2022 America's health ranking report, and then Indiana is ranked 43 when it comes to access for mental health care, which need more attention from the researcher who working on community quality of who working on mental health and for aging. And again, about the mental health care availability in Indiana is also is 21st of rural, particularly there are rural counties lacking even one factor for the per 30,000 people in the state of Indiana. And again, Indiana is 53 of the 92 counties face a critical shortage of the primary healthcare provider, with nearly all of them are being or are rural areas in Indiana, which we can find that is Indiana is we can call the Indiana as a rural state or not. In Indiana is 6.7 million people living there, but between them are 2 million people living in rural areas. Despite the comment of the perception of the Indiana as a rural state or not, most of the Hoosiers, like the majority of the American, consider their communities to be as a suburban. But as you can see in the here at the information, 6.7 million people who live in Indiana, most of them, not the most of them, but most popular population who are 2 million people, they are living in rural areas. And again, here is a map that shows the access ranking indicates how much access to mental health care exists within the state. As you can see, the Vermont, the first state for that, and then Indiana is ranked for 43, which is need more more care, and also research should start working on the mental health and the community quality of life in rural areas, especially for aging. About that, here is more information why the aging and the community quality of life should start as soon as possible in rural of Indiana. Here you can see the figure is showing like in Indiana 65 population as the aging population by the age which started from 2015. It was almost close to 1 million people in Indiana state. But if you see, is like a increase by 2020, again 2025, and based on the report, and in 2014, there will be 1,600,000 of the aging population in Indiana that need, like as I mentioned before, is most important to researchers to start and work more on the rural Indiana, which we already started on it. And in Purdue University, there is a lot of center that are working on the rural health and also for migration. Here another the table is showing the health and the wellness of the need. The first one is you can see they just in some of the factor indicators, but if you can see for the second one having enough food for it, again the first one also feeling or enjoying self of home. If you can see all in 2013 starting with 28% and it increased 29% 2017 and again 2021 is 36%. All these indicators and factors showing that there is increase of the health and wellness need for the aging population in Indiana. Here also another information regarding the aging percent feeling lonely or isolated, which is most important and most important factor in the aging research. It's showing like in Indiana in 2013 was 34% and increased in 2017 with 35%, and in 2021 it was 42% who like reporting they are as like a social isolated in Indiana state. Here is like why it is important, why we should start to work on rural areas, and especially for aging population. The increasing the trend of the older adults migration to rural areas is, as I mentioned in the last slide, is necessarily should start to work on it, and the proactive the need the kind of protective planning. And again, will rural communities already face the significant challenges for their aging population, including limited access to the healthcare, and also for kind of social isolation, which you can see in the last slide. It show like a very increasing. They are reporting they are in that kind of social isolation, and again, to failing to the address to unique needs for this growing demography could lead and significant deterioration of the health outcome and the well-being in rural city. And what we can do, so recognizing the potential for increased healthcare demands and social isolation among the older adults, which is called aging migrant from urban to rural areas, which I call the newcomer in rural areas, proactive intervention are urgently need. I mean, the planning and the research need to start and work and more in the rural areas, especially for Indiana state. What is the gap? About the gap, Professor Sirgy and the colleague in 2001 and 2000, they have developed a model for community quality of life. And they highlight the how domain satisfaction as a positive feeling in the various life domains such as the family, work, and the social life. It contributes to the resident overall life satisfaction, which the project already done. They have already their own model. They work on the urban area mostly, which here is a lack of the intervention of the identify the health and social integration challenges and barriers in the aging newcomers population in rural areas. What we can do is there is no universally accepted standardized model for the community quality of life that address the unique characteristics of the challenges of rural areas community, particularly in the relation to aging newcomers in rural areas. As an innovation, this is a context we propose to develop a community quality of life to be used, formulate necessary protective as a kind of initiative for rural areas, especially for Indiana state, by developing the community quality of life model to as for the newcomer, a specific factor to how we can improve and help them to improve their community quality of life, their well-being and their quality of life. Our overall goal are to examine the influence of community service and condition of aging newcomers well-being in the rural areas, and to utilize the framework of the community quality of life to frame potential ways to improve their well-being. And also in my moreover also in my previous work, I work on the community development literature in the relation to the sustainable development goals, which I published in 2024, I mean last year. is also showing there is a sustained importance of the theme, such as the sustainability, community, resilience, and the link between well-being and the community progress. I started to work on some project here in Purdue, John Martinson Honors College as an iFront. The first one was which start from last year. It's called iFront Door Project, Digital Resilience Initiative, to enhancing the community online presence on community quality of life in community and rural areas of Indiana. And second one is called Community Quality of Life in Action in Rural Indiana. Here is also a related publication which I'm working on it, and also I have a presentation in the ISQOL conference as well, and Community Development Society conference, and I published other two in another conference and the journal, International Journal for Community Wellbeing. Here you can see there is a lot of related publication and presentation for me, which I'm working on, develop and create new community quality of life in rural America, especially for rural area of Indiana state. But it was kind of how can I say, like, as a beginning of the project, the beginning of the call for action, which we already started to work on the community quality of life in rural America, especially in rural of the Indiana, is kind of I believe is kind of introduction as a short presentation to see what we need to do, and the urgent program and planning need for rural area in United States, especially for the state of Indiana. And I hope we can go and continue and share our result for next webinar with ISQOL, and to see what is which I mentioned. We have a kind of the project now, ongoing project, and we will be our result by end of this semester, I mean in April or May. And I hope we can another webinar again in summertime with ISQOL to share that result. Thank you so much again for ISQOL, and I want to say a special thank to Jill, who helped me to organize this webinar. I really appreciate. I'm going to stop my screen sharing, and for next presentation from I believe there is another two speaker, Professor Sirgy from Regional Tech and Professor Taylor from Purdue University. Thank you so much.
Hello, everyone. Thank you for inviting me to be part of this webinar. I'm Joe Sirgy, and I wanted to kind of share with you some thoughts about an article that I published in the inaugural issue of the International Journal of Community Wellbeing. And the title of that article is "What Type of Indicators Should Be Used to Capture Community Wellbeing Comprehensively?" Okay. So let me see if I can share my screen. And I'm assuming you can see this, right? So display swap. Again, it is based on this article, and I'm going to take you through it. So there's again, the title of the article. And by the way, if you want a copy of these slides, I'll be more than happy to email them to you. So the gist of this article is that it sort of makes a distinction between and among different theories of community well-being, and the idea is that one needs to focus on a specific theory, or maybe a set of theories that would help you envision or try and figure out what these community indicators that may be most suited to your own community. And then we'll be talking about individual versus community well-being, and then input versus output indicators, and indicators focusing on the community at large versus vulnerable segments and indicators of well-being versus ill-being. Okay, so making those distinctions would allow us to say, okay, we need to capture the sort of the umbrella of these types of indicators and make sure that all accounted for. Let's start out with the first um, the first idea, which is indicators based on theories of community well-being. Now, some of the popular theories in community well-being can be classified in terms of socioeconomic development, personal utility, just society, human development, sustainability, and functioning. These are different, what you call not only theories of community well-being, but in essence, paradigms of research. There's a whole program of research that is based on these different ideas. Let's take, for example, the most obvious one would be sustainability. Sustainability, we have a huge program of research on what sustainability is. And sustainability focuses very much on the ecosystem, meaning the environment, and then but it takes into account two other dimensions, and that is human well-being, and therefore indicators of human well-being, and also what we call equity indicators. Hossein's ideas is very much grounded in personal utility. Personal utility focuses on the actual how residents in a given community feel about certain conditions and certain services in the community, how satisfied or dissatisfied with these, and ultimately how that their level of satisfaction and dissatisfaction affects their evaluation of the quality of life in their community. Just society is an example of what we call social justice. A lot of people tend to focus on justice types of issues in terms of maybe race relations and gender equality and allowing other vulnerable populations to have access, sort of equal access to community services and conditions, and so forth. So I'm not going to have time to really get into these, these theories are well described in the article, so you'll be able to read all about them in the article. Okay, let's move on to the second point, which is individual versus community well-being. In this context, the idea, well, there's so many of the indicators tend to be focused on the residents themselves, meaning the individual residents, community residents. But on the other hand, there are other indicators that focus on the community at large without necessarily focusing on the residents, especially for those people who do survey research and try and capture, for example, satisfaction with, for example, transportation versus among many other types of services in the community. These tend to be individual based, right? So again, the example that I have here is satisfaction with utility services. But on the other hand, community level indicators tend to be very much at the community level. And the example would be crime rate. The crime rate at the community at large, capturing the community at large. And the idea is that, there are indicators that focuses on the community at large, which captures that with the fact that the whole is greater than the sum of the parts. The parts would be the residents, right? So if you can capture satisfaction in the mind of each resident in the community, yes, that's good, but you also need to capture the whole, and the whole may be greater than the sum of the parts. So you can't just simply count, satisfaction of services in the community and say, okay, I have those community quality of life indicators. Well, that's not sufficient. That's not sufficient, right? So the idea is that we need to incorporate both sets of indicators, individual and community level indicators. The third point is input versus output indicators. Now, what does that mean? Input versus output indicators. So input indicators are related to action or policies. So, and an example here, for example, an example would be a dollar amount of financial investment in prenatal care for pregnant women. Okay, so this is something that, again, you do, it's action oriented versus an outcome. The outcome would be, again, output indicators are related to outcomes such as changes in average years of life expectancy, infant and child death rates, and rates of criminal activities. Now, again, these are outcomes, right? Outcomes of certain things that happen in the community, certain services, certain policies, programmatic action, that kind of thing. So the idea then is that when you're developing or when you're accounting indicators of community quality of life, you need to have both sets. You need to have policy or action-oriented types of indicators, as well as what you call outcome indicators. They're both essential. Okay, let's move on to, again, the fourth point, and that is indicators focusing on the community at large versus vulnerable population. So there's so many, community indicator projects that focus on not necessarily on the community at large, and they do it, most of them do actually, but they focus on specific populations within, like, for example, the disabled, or women, or the poor, or specific minorities or children. Again, these are vulnerable populations, and one develops a whole set of community quality of life indicators around those particular segments, what you call vulnerable segments. So again, the idea is that if you're doing community quality of life type of research, and you're trying to identify those indicators, you need to take into account both. You need to, to do this at large, as well as identifying those vulnerable populations within the community, and also develop those indicators that would be relegated to those populations. Finally, we can talk about I have a specific slide that that I kind of skipped, which essentially says exactly what I need to say about, again, the community at large versus vulnerable segments. The final point is indicators of well-being versus ill-being. Now, here, again, we make the distinction between ill-being and well-being. Again, ill-being indicators reflect aspects of satisfaction of basic needs. So again, if you're familiar with Maslow's idea of human motivation or human needs, or the hierarchy of needs, there are basic needs that are so important, and not being able to meet those basic needs generate what we call ill-being. But on the other hand, in the context of Maslow's hierarchy of needs, we can talk about growth needs, and meeting growth needs generate, again, a sense of satisfaction rather than dissatisfaction. So again, the focus is, so the examples that I have on this slide is that well-being indicators related to social life at the individual level include social isolation, social disengagement, social avoidance, social shyness, personal victimization, And at the community level, these indicators may be reflected in community strife and crime rate. These are indicators of ill-being. Well, and again, in contrast, well-being indicators reflect satisfaction and growth needs, which again, the example would be well-being indicators related to leisure life include frequent engagement in leisure activities, social connections built through leisure engagement, and sense of relaxation and stress reduction during leisure time. At the community level, these indicators may be reflected through readily accessible leisure facilities and spaces and high participation rates in diverse leisure activities. So you see that there's quite a bit of difference between focusing on indicators that capture ill-being at the individual and the community level versus indicators that capture well-being at the individual and community levels. And the point is that, again, if we're doing this comprehensively, we need to do both. Again, we need to do both. We need to capture indicators of well-being as well as ill-being. Okay, so that's the gist of my little story. So again, what we did is we talked about how we can capture community indicators comprehensively. And that means that we need to kind of focus on specific theories of community well-being and make sure that we feel comfortable with these theories, because these theories have their own set of indicators. So again, if you're talking about something like personal utility, again, the idea is to capture satisfaction with community services and conditions, and that in essence would give you an entree to those indicators. Individual versus community well-being, again, we talked about that in terms of doing both. You need to capture indicators both at the individual level as well as the community level, and the reason being because the sum of the parts does not capture the whole. In the input versus output indicators, we talked about action indicators versus outcome indicators, and we need to have both action indicators as well as outcome indicators. And indicators focusing on the community at large versus vulnerable populations, yes, we need to do both. And finally, indicators of well-being versus ill-being. Again, we need to capture both sets of indicators in order to comprehensively assess the quality of life of the community over time. So that's the gist of it. And again, thank you. And if you'd like to have a copy, just send me an email. It's sirgy@vt.edu. I'll be more than happy to send you those slides. Thank you again.
Okay, good morning, everyone. My name is Zoe Taylor. I'm an associate professor of human development and family science at Purdue University, and my talk today is a little different. I'm going to be talking about community quality of life in rural Latinx families in the Midwest. So the population of Latinx or Hispanic immigrant families in the Midwest has grown considerably over the last few decades. So if you can see on my screen, the first map is of the US in 1990. And you can see that a lot of this population was concentrated in Western states, such as California. And the blue map on the bottom is from 2023, and you can see that populations have increased, especially in areas in the Midwest, which is where, of course, we're located in Indiana. The US Hispanic Latino population reached 65 million in 2023 and accounts for almost a fifth of all Americans, which is the nation's second largest racial or ethnic group after non-Hispanic white Americans. And it's important to note that the origins of this population have been changing. So even though we tend to think of Latinx families as coming from Mexico, one of the fastest growing populations are actually populations from Central America, such as from Venezuela, Guatemala, Honduras, and places like this. So you can see the rates of these populations, even though they still remain fairly small in number, have increased considerably in terms of growth. And a number of these populations are in the Midwest area as well. So this presents unique challenges for families who are moving into rural areas. The communities in these kind of what we call new destination areas may be unprepared or unwilling to accommodate Latin newcomers. This could be lack of resources, lack of Spanish-speaking areas, or it could be due to feelings of discrimination and interracial tension. We also know that rural areas tend to have higher levels of poverty and lower resources and supports, and this is sort of equally or more so for immigrant families as well. Immigrant families are more likely to experience stresses in rural locations, such as language barriers, geographic isolation, and work-related stress, because a number of these work-related stresses are due to working in low-wage jobs. A number of jobs in rural communities are jobs such as farm work or meat packing factories that tend to be long work hours, low wage, low status, and often dangerous jobs. So my work, and I'm going to switch to sort of talk a bit about my work with families, really focuses on a number of these structural risks that I'm defining as these broader social, physical, economic, or political environments that shape or constrain adjustment and health of individuals. I also want to note a specific subpopulation of immigrant Latino families, which is migrant farm worker families. So this is a population that is especially vulnerable, and I do a lot of work with youth populations, although I work with families in general, and in particular thinking about youth and children in farm worker families. So these families have very unique challenges because they are migratory. So here in Indiana, we have a large migrant population in the summer because of the corn that gets harvested in the summer. And there is a lot of families that come from other states such as Texas and Florida. And often children are coming, children and youth, to engage in this work with families. This results in challenges for kids if school is being disrupted, work conditions are hard, and families in this community often experience, again, these same kinds of stresses such as marginalization, isolation, and discrimination. As well. So I've been at Purdue University for about 12 years, and I came here from California, where the Latinx population is, as you saw from the map, quite extensive. And so my work since I've been here has really focused on rural areas. And I've had 3 different studies, kind of going from right to left here, starting with a small pilot study that I collaborated on with someone in my department, Professor Blake Jones. And then the last 9 years now, I've been working with Professor Yamari Ruiz, who is Associate Professor in Public Health And we've been focused on preliminary with farm worker youth and their families, which was the Latino Migrant Families Project. And then for the last 5 years, we've had a ongoing longitudinal study, the Purdue Puentes Project, that's funded by the National Institute of Minority Health Disparities, that's focused on youth and their primary caregiver in rural and agricultural families. So about a third of our sample are families that are part of the migrant education program, and the remaining population is rural families in the surrounding area in Indiana. Focus is looking at stresses and acculturation, especially related to either immigration or migration, mental and physical health, as well as behavioral health, and especially focus on positive youth development. So I'm going to talk more about this project today and just go through some of the findings that we have, especially in relation to community. So my work really takes a family systems perspective with the idea that I focus a lot on specifically on mental health, both in primary caregivers and in children and youth. And taking a family systems perspective means that I'm looking at the whole family, and that children's mental health is linked to their caregivers' mental health. I also focus a lot on resilience processes, and here family systems again is a useful lens to look at in the regard that the families that I study often experience a variety of stresses and vulnerabilities, but the strength that are within the family is an important factor to look at, and having a healthy primary caregiver can mitigate the impact of detrimental adversities or stresses. So can think of caregivers as this protective shield, helping, of course. The opposite is also true, that a caregiver who is stressed and overwhelmed by stress can also exacerbate that for kids as well. But we focus a lot on families in our project as well, and family health and well-being. So we're finishing collecting our third wave of data for the study, and we have my work has specifically looked at mental health. As I said, we were funded during COVID, so our project started assessing families during COVID. So we have a sample of 307 families, and at time one, we had almost a third of the youth had moderate or severe mental health symptoms as measured by anxiety and depression. We also found that both parent and youth pandemic stress was related with poor adjustment in kids and negatively impacted positive well-being, things like connectedness, optimism, the things that we would like to be seen as fostered in youth. The pandemic negatively impacted academics, as you would imagine. And we've started looking at kind of community impact for these families to see how the community either supports or negatively impacts their well-being. And as you can sort of see here, it's sort of a mixed bag. We see that both parents and kids report experiencing marginalization and discrimination, and this relates to depression and anxiety. But those who report having cohesion in their neighborhood reported better global health. So we're kind of digging into that a little bit more. Our sample is a little unique in that we have a large population of kids themselves who are immigrants, so first-generation immigrants, and We're also looking at examining differences between kids who are US born and those who aren't. And we found differences in mental health for first generation youth. They report poorer mental health, but also poorer connections to important contexts like peers and school, although they don't differ in terms of their family support. So that was really nice to see. The family remains an important source of support. So this is one of the factors that I pay a lot of attention to in my work is the impact of family support, and other people in my lab do a lot of work on socialization and cultural practices. And what we've really seen, even though these kids are early adolescents, when a lot of their support, typically we think of coming from peers. For this population, we see family and especially mothers as remaining a key source of support for youth and relating to their resilience and mental health. We see a strong role of cultural values and family ethnic socialization as well. And we also see an impact of mothers reporting better community environments, and that positively impacting their parenting. So, being able to think of the ecological context of how parents are parenting and how in turn it impacts youth is one of our focus of the project as well. So overall, we really are focused on this kind of joint role of culture and parenting as it relates to health and well-being of children. So I'm going to quickly just show you one of the results of a paper that was published last year. The family stress model is a model that I use a fair amount in my work. Essentially, it's looking at how poverty and economic pressure increases parent psychological distress and other behavioral problems in the family, such as interparental conflict, which in turn disrupts parenting and results in adjustment problems for youth. I extended this model in a paper by thinking about culturally relevant structural risks. So some of the things that I've just been talking about, thinking about acculturation, stresses, discrimination, and of course, because as I said, our study was started during COVID, I also looked at COVID. Our research is mixed method. We do both quantitative and qualitative work. We collect qualitative interviews, and so we're able to gain some deeper insight through our qualitative work. And I'm going to show you a little bit of that as well. Overall, this looks a little busy here, but overall, the family stress model was supported, and what we found here is that these structural factors, discrimination, COVID stresses, and also negative immigration experiences were linked to family functioning, especially through increasing psychological distress in parents, but also increasing economic pressures. So you can imagine that COVID, the higher numbers of stresses experienced by parents during the COVID-19 pandemic was relating to increasing feelings of economic pressure. And this trickles down to, again, to parenting, and then in turn, the outcomes for youth. We, as I said, we have qualitative interviews and with both mothers and with kids, and these are some mom and kid quotes when we ask them what the main stresses or challenges were. This is, again, during COVID time, so you can see, again, the impact of community and also economics here as well. So moms talking about financial stress and it impacting not just their finances, but then in turn, mental health. The first mother here talking about feeling a burden for her children. We have kids who are feeling lonely because parents are working a lot. So this kid says, that her mom leaves at 4 p.m. and doesn't get home until 5 a.m. So they really don't see one another very much. A lot of moms and parents reporting discrimination in the workplace and due to maybe not being documented, not really having any way of fighting back against that. And the last quote I wanted to put in because it's important, that there were a lot of strengths that moms did talk about in terms of wanting to be a role model for kids. And so this one mom telling her child that she wasn't born knowing how to be a mother and that she's been learning and really sort of asking to communicate. So we really try and look at strength here as well. This ties into a paper that we did a few years ago that really shows the importance of family support for kids' resilience. Just quickly here, this is basically looking at the impact of supportive parenting on child anxiety as a function of stress. And what we found here is that kids who reported high levels of acculturative stress, so this would be things like language hassles and other kinds of stresses, even if stress was high, if they reported high support from their parents, their anxiety didn't go up. And so really showing the impact of support and family as a resilience here. And we saw this also not just quantitatively, but also in the qualitative research here as well, where youth are talking about their parents in very positive ways as sources of support. So kids talking about moms making soup when they're feeling sad, or being fighters, or really helping them when they need it. The last little piece I wanted to talk about is that, as I said, a number of our kids have first generation. Most of our parents are immigrants, and of course, migration and displacement really is one of the defining issues of this century, and kids are disproportionately impacted. So even though this is not the focus of our study, we're seeing the impact of these kinds of issues in our study because we have a number of kids who have been displaced due to a variety of reasons. And of course, this can result in impacts for kids and their families, but we don't know a whole lot about mental health of migrant youth, especially those who have been involuntarily displaced. We're just beginning to look at this in my study, and through some of the qualitative work, I'm bringing up some of the quotes that we've seen. We didn't specifically ask kids about this, but we did ask them about how they came to Indiana or what they think about Indiana, because a lot of them come from other states. And what we ended up finding was a lot of kids talking actually about their migration stories, and a number of them were very heartbreaking but compelling. So kids who were talking about interacting with law enforcement, others missing family members and their time in their country of origin, Sometimes kids would talk about the dangers of their country and maybe threats to their family members as a reason why they ended up in the US. And here is another kid who talked about coming with her dad but leaving her mother behind. So this was also a common theme in our qualitative interviews about families being separated as well. So in conclusion, the context of rurality for Latinx families here in the Midwest exerts numerous contextual stresses, and this impacts the well-being and functioning of family members, both in terms of youth adjustment and parent adjustment. Resilience processes are dependent on resources that an individual and a family has, and often these are families that do not have the resources. It makes resilience difficult, although we are finding resilience in our families. So one of the pieces of work that we're really trying to look at is looking at structural barriers that are inequitable and of course are detrimental, and this is increasing, of course, for the families in our study over the last few months. And I would like to note, even though I've sort of presented some risks, then my lab is really taking a strength-based perspective, and we look a lot at pro-social behavior, social support, resiliency, the importance of dispositional traits like self-regulation, and also the community, and that this work needs to continue. That is what I have. I don't know if we'll wait for questions, but.
Thank you very much, Professor Taylor, for your presentation. Also, thank you, Professor Sirgy and Dr. Mousazadeh, for all these very interesting presentations. We are going now to do the Q&A session. So we're going to start with Anthony, please, if you have a...
Yes, thank you, Roger. Yeah, well, I mean, for the two of you plus the bit of the presentation of Joe, well, thank you very much, first of all, for everything. I have a question for our last speaker. Zoe, I was thinking about the stressors, and based on, the quotes you put, I saw different age, different countries of origins. So I was wondering to what extent all these social demographics, say, could moderate all the effects. Maybe gender plays a role, maybe the age of migration. Like, can you tell us a little bit more about this, please?
Yeah, we're still sort of digging into that. One of the unique aspects of our study is that that the kids actually, in terms of their origin, are coming from like Guatemala and El Salvador and Honduras. When we look at the origin of parents, it's still mostly Mexico, which is what is more common in the United States. But we're seeing this from the kids. So definitely it varies, I think, in terms of children's experiences, although as you see, a number of the kids were very young. So it's not just teenagers who are describing some of these quite sort of scary kind of traumatic experiences. It was young kids too. And of course, I'm just pulling up a couple of quotes, but we have, they do range, and there are really differences by gender either that I could see right now, unfortunately. So yeah.
I'm not terribly surprised. I was thinking maybe they're too young yet, so that there is really a gender effect. Maybe the shock is such a huge shock that irrespective of your gender,
Yeah, one of the things that does make it more difficult for families from places like Guatemala is that a number of those families are not very fluent in Spanish or English, and that makes it even harder to integrate into communities here in the Midwest, in particular, because then you're not fluent in either of the sort of languages that perhaps could be helpful to you. So, yeah.
Thank you.
Fritz, do you want to ask your question, please? Fritz, no?
All right. Hello. Hi, Roger. Thank you very much to both Professor Taylor and Professor Mousazadeh. I found the presentation both excellent. Thank you so much. And I'm so sorry that Professor Sirgy missed out on finishing his talk, which looked really, really exciting. I joined this session a little bit late. I also had some connection issues, so I missed on the introduction at the very beginning, and so because of that, I want to ask Dr. Mousazadeh and Taylor how they see the connections between the two papers that have been presented. Sorry if I'm sounding like a journal editor. I've been working on a special issue for the journal I edit. So I've been asking this question over and over again in recent weeks and months. So with that kind of a hat, I'm now asking our two fantastic presenters here how they see the links. I mean, I can guess what the links are, and I can see some links myself, but just curious to see how our speakers see that. Thank you.
So, Professor Taylor may ask you to start for that question, and I'm going to continue.
Sure.
Because I want just kind of, I should say it in the introduction, we started to work on this project with as kind of community quality of life in an aging as a newcomer moving from urban to urban areas, which I have here Professor Taylor and Professor Sirgy as they are also in my team as my mentor and also for my advisor. But that's why I want to ask my mentor first to go ahead, and then I will go and continue about the question which Professor Parviz also already asked you. Yeah, thank you.
Yeah, because obviously my work is less about aging, although I do study older adults because of the family systems perspective. So, but of course, thinking about community well-being in the populations of families who participate in studies that I'm leading is critical right now, and especially. With everything right now is really important. The community, thinking about the community impact on families, on immigrant Latino families in the U.S. right now is it's pretty devastating, and because communities are not safe. So even though we're thinking about community well-being, then really for me right now, we're really thinking about communities as potentially not being a source of safety, and so I think it will be interesting for us to think about how we can look at that again, in terms of sources of support and well-being. But
yeah, thank you so much. And just want to add, after 33 years, I go back to the rural areas where I grew up, almost 20 years in the rural areas, and I'm so happy that I go back to my experience to see there was a lot of problem where I grew up till I was age 20, moved from rural to urban to start my undergraduate program. But I'm so happy that I'm go back to rural areas, working again for how I can empower and how can I improve the quality of life. And which I found recently, based on the report and which I did before on some communities in Indiana, there is a gap, is a kind of problem, I can say, or kind of gap in the role of Indiana, especially maybe the whole country of US, that there is a gap about the aging, who moving from, when you know, most of them are retired and they are more than 65 or 70 age, and they're moving from urban to non-metro, which I can call rural areas, and there is no research done before to see how the newcomer, when they are in urban areas, they have good access for everything, especially for healthcare center, for hospital, for for transportation. Even the transportation is one of the factors for community quality of life. But there is no lot of research done before. That is why I find that gap in the problem in rural Indiana, especially Indiana is, which I mentioned in my slide, there is like 2 million people living in rural areas in Indiana. So huge of the moving from urban to rural areas, and again and again and again, which I can say like the food comes from rural areas, energy comes from rural areas, the veterans come from rural areas, the fresh water, fresh food come from rural areas. That's why I believe like rural areas need more like more attention, especially for aging as a newcomer from urban to rural areas. And I'm now in Washington, D.C. for NRHA, like the National Rural Health Association Conference and Institute. And we had a meeting yesterday in Capitol. I was kind of like excited for that, the first time to be in the Capitol and talk about like on behalf of the Indiana rural area as a young researcher who working on aging. And I just transfer that like concern and that problem and that gap from Indiana, just on behalf of a kind of research who work on aging recently in rural area. I just mentioned that also in Capitol. I hope we can work on. Sorry, yes. Royal.
Yes, thank you very much. We have time for one last fast question. Hassan, please.
Hello, everybody. I'm very glad that I'm here. That's honestly, I'm the twin brother of Dr. Hossein. I'm the researcher at the Kazimierz Bajk University in Poland, as I'm just working on the project about the quality of life of the older adults in rural area in Iran, in Sweden, and in Germany. So I just want to add one thing more important that I found from my research that I'm doing here in Poland. So as Dr. Hossein mentioned, that's the older adults in a rural area are often really deeply connected to their communities. They're contributing through the volunteer work, caregiving, and also local economics. And I'm sure that that's ensuring their well-being and their support their broader community resilience and also sustainability. So I think that as immigration patterns shift and also more older adults either remain in or return to rural area, we need policies and also programs that promote the social inclusion, age-friendly infrastructures, and also accessible healthcare for the older adults in the rural areas. So by paying the attention to the community quality of life in rural setting, we not only enhance the individual's well-being, but also create a stronger, more sustainable communities across the different culture and also geographical contexts as well.
Yeah, thank you so much, Hassan. I really appreciate for that. As he mentioned, he's my twin brother, doing research in Poland and working on migration population who moved from Iran to Europe. But yeah, which I mentioned before, I'm in DC for NRHA Institute for Policy Institute, which I believe like a policy should be like a very first of the programming in the rural areas. But thank you so much for mentioning that and highlight. Thank you.
So thank you very much to all of you also to attend this fantastic meeting. And I will now ask if Jill wants to add something before closing the meeting.
Sure, thank you again to everyone for participating. A reminder, we'll be sending an email to everyone who registered with the recording and a link. We invite you to consider joining us as a member again. Please participate in any of our upcoming events focusing on happiness, well-being, quality of life research. Of course, you can find out more information online at isqols.org. With that being said, I just want to say thank you to our participants, to Anthony and Roger for managing the Q&A, for serving as moderators, and to our presenters, Dr. Mousazadeh and Dr. Taylor, Dr. Sirgy. Your perspective on this important topic was enlightening and certainly a topic that deserves a lot of attention. And we hope you consider presenting future research with us with the ISQOLS community as well. Dr. Mousazadeh, I believe you are presenting in the winter conference. Is that correct?
Yes, exactly. Again and again, I start like kind of project working on rural areas, which I mentioned in the last slide. I'm going project as a presentation, but yeah, I'm going to present. It's so close, this presentation on ISQOL winter conference. Yes. Yeah.
Registration is open, so please do consider joining us. Thank you once again for your valuable contribution, for your time today. Thank you, everyone, on behalf of ISQOLS. Take care, be well. Goodbye. Thank you.
Thank you. Thank you.